Hey, if anyone's on, thanks for joining our webinar, How to Be a Superhero in Your Renewal and Strategy Meetings. We're just going to take a minute or two to wait for the stragglers to come on, so just hold tight for a minute or two and we'll get started shortly. Hey folks, just wanted to, we're going to wait another few minutes. Just going to loop through a couple of housekeeping slides here about how to interact with the webinar tools. So we should get started shortly. Okay, folks. I think we're ready to get started. Thanks everyone for joining our webinar today. How to be a superhero in your renewal and strategy meetings. A couple of quick housekeeping items. Dave Gutman, President of First Stop Health. I'll be presenting today. Kicking off our webinar. Everyone's automatically put into muted mode, so we're not going to be opening the audio lines. We will be, at the bottom though, you'll see there's a link for a Q&A option, so just click there if you want to ask a question. We'll cover those at the end. There will be 4 polling questions, live polling questions asked during the webinar, so responses are really appreciated. And if you're having a technical issue or want someone to try to help you with something, there's a chat option. Just click on that button as well, and one of the folks on our team will help you out. All right, we're going to jump in here. It's estimated in 2019 that there was about a 4% average increase in healthcare costs over 2018. With the employer costs for every employee approaching almost $15,000 a year, more of this cost is being shifted to employees, and in a tight labor market, not a whole lot of good news. You know, generally people going into renewal and strategy meetings, nothing but bad news. So with that, I wanted to start with our first polling question. You'll have about 15 to 20 seconds to answer. So in approximately what % of your renewal and strategy meetings did you bring a reduction in spend from the year prior? None, less than 5%, 5 to 25%, 25 to 50, more than 50%. And we'll give you a few seconds to respond. All right, about another 5 seconds. Okay, now let's take a look at the results. Yeah, so you can see somewhere between 80% had 5% or less of their renewal and strategy meetings with a reduction in spend. So not a whole lot of great news. So our goal in this webinar is to help both employers and the benefit consultants that serve them understand how a really well-implemented telemedicine benefit can be an easy win as you look to finalize your benefits packages for this upcoming year. We just completed our 2019 annual client survey, and there were some really interesting statistics I wanted to share. On the employer side, 68% of our HR executives said that employees thanked them for adding our telemedicine benefit, and 79% bragged to their CEO or CFO about the financial results of our program. On the benefit consultant side, 66% of our clients thought more highly of their benefit consultant because they brought First Op Health benefit to them. Now, I'm fairly sure that most folks on the phone here know what telemedicine is, but just really quickly, 24/7 access to a doctor via phone or video to treat episodic health issues at a much lower cost. So while the things that we treat are pretty simple and episodic in nature, like a sinus or upper respiratory infection, those things do happen a lot. So telemedicine can help avoid about 60% of those things you would normally go face-to-face to see a doctor for. And so one of the happy consequences of a well-implemented telemedicine benefit, it's one of the few benefits that nearly 100% of any employee population could use in any given year for themselves or one of their family members. And when you really look at the telemedicine space, what you see is that the rest of the industry has solved the telemedicine problem like an insurance company might. And First Op Health has solved the problem more like a services company would. And we have organized ourselves as a company from top to bottom to be a services company. Just like gym memberships, most telemedicine providers' business models are predicated on low usage in order for them to be able to make any money. Over 2/3 of all gym memberships go completely unused. That means the average American, every time they go to the gym, they're basically spending $120 every time they grab some weights. Traditional telemedicine offerings follow a similar pattern. Just a few days ago, we were working with a benefit consultant on a 5,000 employee group that's currently with one of our competitors. Now, while the competitor was only charging a 90-cent PEPM, because they'd only gotten 70 consultations in the last year for a 5,000-person group, that works out to nearly $800 per consultation. For $800, you could afford to have a doctor do a private house call and still have money left over to pay for your gym membership and your cable bill. All right, polling question number 2. What are your biggest challenges in adding a new benefit for your company or clients? And please pick the top 3 if you don't mind. We'll give everyone a little bit to go ahead and answer. About 5 more seconds. All right, let's take a look at those results. "68% said engagement is the, so it's the single biggest challenge. Lots of challenges, but single biggest challenge, 68% getting engagement. So, and when you really think about it, getting engagement is the biggest risk in adding a new benefit. Regardless of the benefit, the trick is getting people to use it because anything times 0 is 0. Making employees aware of a new benefit and potentially getting them to change their behavior to use that is no small feat. The last thing an understaffed HR team or benefit consultant wants is yet another benefit they have to drive utilization for. And then, to make matters worse, we did a survey earlier this year in April on another webinar that we did. Nearly 50% of employees value their benefits at less than half their actual value, and over 11% didn't value their benefits at all. That's what happens when you have benefits in place that nobody uses. And the reality is, telemedicine can make an impact, but only if you get utilization. 92% of the time, we will divert a more expensive face-to-face visit, but you can only get it if you can get people to use it. So as I mentioned earlier, First Stop Health considers ourselves a services company. Our entire organization is organized around driving engagement, getting utilization, and delivering value. Let me walk you through what we do that's different on the engagement side. As with any new benefit, the first thing you have to do is generate awareness, both that they have the benefit and when it's appropriate to use it. Gunshot wounds and chest pains, you probably want to go to the ER. Sinus infection or pink eye, give us a call. We'll do as much as 12 touches through snail mail, email, you name it, in the first 90 days. We also do seasonal campaigns throughout the year, and we can even do on-demand campaigns as the circumstances or needs of a particular client might warrant. About 75% of our engagements fairly cookie cutter, but that last 25% makes all the difference, and I'll give just a couple of examples to make the point. We have a crop dusting manufacturer in rural Georgia, mostly men, low level of education, no email addresses, a really difficult group, and after the first month we had no consultations. That can't happen. So we sent our customer success team down to middle of nowhere, Georgia, met with the whole company in groups of 20, and now they have 85% utilization. Now, best part of that story isn't the 85% utilization, though that's great. It's the fact that 100% of the costs to do that were borne by us. All the client will ever pay, and we'll come to this in a little bit, is the PEPM fee that we're paid. Any fees that are any costs necessary to drive engagement, we bear 100% of those costs. Ulta Beauty is another client of ours. They were very tricky because we needed 3 different engagement campaigns and strategies, one for the distribution center, one for their corporate office, and a really tricky one for their stores. And the stores were tricky because they have 35 people on average in every store, but only 8 are on their plan. So we designed a swag box that was sent to the store managers with a water bottle with our logo and a bunch of things to hand out, and now they're getting terrific utilization. And again, just to reiterate, we fund 100% of the cost to do any of the engagement and do all the heavy lifting. All the HR team and benefit consultant has to do is approve the communication. And we try to let data really guide what we do. We do persona-driven marketing so that a 23-year-old single guy with no kids gets different messaging than a 35-year-old mother of 3. If we have access to claims data, we can even tag employee personas with those individuals that have higher than average ER or urgent care usage for the types of things that we treat. Not in a creepy big brother way, but we can say, hey, did you go to the ER for one of these 10 things? Did you know you could use your great free telemedicine benefit? We might have a client with 10 locations and a couple are lagging, so maybe we'll send someone on site to hand out some materials or do a postcard and phone call campaign to those individuals. And again, nothing happens without the client or benefit consultant approving the communication, but we bear 100% of the cost and the efforts to do the implementation. One of the reasons our utilization is so much higher than the rest of the industry is we've taken as much of the friction out of getting someone to try our service as possible. Less than 2% of Americans have ever done a telemedicine consultation, which is basically the same as nobody. And so when you're trying to change behavior, it generally is expensive and difficult to do it. The most obvious form of friction is the copay that's normally associated with telemedicine. About 85% of the telemedicine in the market is embedded through the carrier and therefore has a $35 to $45 consultation fee. Most people are not going to pay $40 to try something they've never done, and if it doesn't work, they have to pay another $40 to go to urgent care or to try to get in and see their doctor. But much less obvious, but probably even more impactful than the pricing friction, is the fact that we've eliminated all of the sign-up friction to use our service. With every other telemedicine provider, before you can use their service, you have to download something, upload something, register, put in your default pharmacy, credit card, etc. With us, you don't need to do anything. All you have to do is call our toll-free number, and then we make sure that our number is everywhere but tattooed to every member's forehead. We get a census enrollment file and validate membership with name, date of birth, and home zip code, and you can even add dependents on the fly if they're not in the enrollment file that we've gotten. And while we allow and appreciate if our members register before they do their first consult, only 8% of our initial consultations pre-register before they do their first telemedicine consult. And we were so surprised by how low that number was. When we asked our members why, their answer was so simple and obvious once they said it. When people are sick, they don't want to bother. And when people are not sick, they don't want to bother. And then the last thing is when you finally get people to use the service, they better have a perfect experience or they're not going to use it again and they'll tell anyone who listen they shouldn't either. Our goal is that our members are talking to a doctor in under 5 minutes. We're currently averaging under 3. That if they need a prescription, they have it in less than an hour, and that it didn't cost them anything to talk to our doctors. If you can do that, that's about as good as getting sick will get. Just a couple of high-touch things that we do that the rest of the market doesn't. Our doctors try to reach people twice and leave a voicemail if they're unable to reach the patient, but we don't leave it there. The consult is automatically escalated within our system, and they're contacted to see if they want to try again. Let's say, another example, let's say you weren't feeling well, but you were at work and you were calling during your lunch break, and your plan was to pick your prescription up on your way home from work. But you got stuck at work longer than you expected, and now the pharmacy is closed. Well, good luck dealing with an issue like this with most of our competitors. With us, you'll call the same number you called to talk to our doctor, and instead talk to one of our 24/7 patient experience agents. They'll find you a 24-hour pharmacy on your way home and resend the prescription to that pharmacy so it's waiting for you when you get there. Part of having a world-class service is making sure that our doctors are always delivering an outstanding experience. We have the best doctor network in all of telemedicine. All of our doctors are board certified and go through a rigorous background check and training program. We review 100% of every new doctor's first 10 consultations and then 10 to 15% of all consultations after that. Industry average is only to review less than 0.5% of the consultations. So we're reviewing somewhere between 20 and 30-fold more consultations than any of the other players in the space. We want to make sure that our doctors are easy to understand, professional, caring, with great phone-side manner, and we also review their prescription and referral rates to make sure that the quality of clinical care meets our highest standards. As I mentioned earlier, telemedicine is one of those few benefits that almost everyone can use if it's implemented well for themselves, a spouse, or a child. We actually do a 30-day impact review with all of our clients, over 250 employees, and for all the ones that I've been on almost every case, the head of HR said, in my 10, 15, 20-year HR career, I've never had so many people come up to me in the first month of a benefit and thank me. And this dovetails with what we saw in our most recent client survey. 68% of our clients self-reported that their employees thanked them specifically for adding the First Stop Health benefit. Polling question number 3. Do you or the majority of your clients currently have a telemedicine benefit? So, if it's embedded through the carrier, pick the first option. If you're getting it, direct from another, telemedicine provider, then pick the second one. Yes, it's carved out, or obviously one of the other two. I'll give you a few seconds. Couple more seconds. All right, let's take a look at the results. Yeah, 68%, the vast majority have it embedded through the carrier. Last polling question. Approximately what is your company, or if you're a benefit consultant, your client's average telemedicine utilization? Give everyone a few seconds. All right, let's look at the results. Yeah, 50% have less than 5%, 20% 5 to 15. So it's like literally no one has above 15% utilization for all the folks on this webinar. So most people are usually fairly impressed with our benefit, and so we're sometimes asked, do you ever lose to other competitors, and if so, why? The reality is in the last 4 years, I can only think of a single time where we lost directly to a competitor. What we do lose to is the inertia of the client doing nothing because their carrier has an embedded telemedicine benefit. So let me just say a few words, that plus the results we just saw on the polling questions, let me say a few words about carrier embedded telemedicine. Because most of the market's carrier embedded, at first it looks like every other benefit out there, nearly everyone has it, but almost no one is using it. Carrier embedded telemedicine utilization is so poor that most of the companies we talk to either don't even know if they have telemedicine, or if they do, they're unaware about who their vendor is. Believe it or not, at First Stop Health, we have Teladoc embedded through Aetna. In fact, nearly 100% of our clients have a carrier embedded telemedicine offering that no one's using, of course, alongside our offering. Ironically, that's the only good thing about how bad carrier embedded telemedicine utilization is. No one gets confused because no one knows they have it. At First Stop Health, our average utilization across our entire book of business last year, no cherry picking a few good clients, 56%, our average results. Over 25 times better than the carrier embedded solution. And so if you remember before from our polling question, no one had above 15%. We don't have any clients under 15%. Our average is 56% across our book. So it seems really odd, right? The carrier embedded solution is obviously really poor, and yet almost all the telemedicine that's out there is carrier embedded. So let's talk about a few reasons about why the model is just fundamentally flawed. So obviously low utilization is the obvious one, but perhaps slightly less obvious is even when you do get people to use the benefit for the handful of times, it still gets run through as a claim, albeit at a lower dollar amount, but there's still a claims impact. And generally, the vast majority of telemedicine that's embedded through the carrier has a consultation fee required. And there's a fundamental conflict of interest. Carriers' profits are set based on a claims to expense ratio. Telemed claims are at a lower dollar amount. So if you're a health insurance carrier, you have no incentive to promote it. But let's say by some miracle, through the Herculean efforts of the HR team, the benefit consultant, or both, they get decent utilization and then they switch carriers. Congratulations, now you get to start all over from scratch. Now, the shame of it is that while carrier-embedded telemedicine is perceived to be no cost, the reality is there's a significant cost to not putting in place a high utilization telemedicine benefit. So let me just walk you through the math to explain. So I'm going to compare side by side carrier-embedded to our results. So for the carrier-embedded, there actually is a small 30-cent PEPM, but for the purposes of this math, we're using 1,000 employee company, keep the math simple, 0 PEPM, a $40 consultation fee, 2% utilization, versus our $445 per employee per month for groups over 1,000, no consultation fee, and a 56% utilization. The bottom line is that in a 1,000 employee company, you're going to have 540 more claims hit their claims experience and over $70,000 to the worse by leaving a carrier-embedded solution in place versus the results our average client would get. As a result of this crazy difference, many of the benefit consultant partners we've been working with for years where we already have all their self-funded clients, they are primarily using us as a prospecting tool because we're a guaranteed way to make the incumbent benefit consultant look bad. Because if they've left a carrier-embedded solution in place and they've set $70,000 of their client's money on fire, what else have they maybe not looked at as closely as they could have? So in addition to our best-in-class utilization, our other key differentiator and how we make choosing is the fact that we make it a financially riskless decision for any self-funded employer to choose us as their partner. We have the only savings guarantee in the industry where we contractually guarantee 125% of our fees in hard dollar savings, putting 100% of our fees at risk. So basically, for every dollar we're paid, we're generating $1.25 in hard dollar savings. So if we got paid $10,000 in fees, we have to generate $12,500 in savings. Now, we really pride ourselves on being transparent and fair-minded in how we calculate those savings. So in a couple of slides, I'm going to walk through that math. But real quick, I figured I'd kind of just quickly go over our pricing. Sort of alluded to it throughout the presentation so far, but groups under 1,000, $545 per employee per month. Groups over 1,000, $445 PEPM. Now that's an all-in price. There's no other charges, not for setup, implementation fees, engagement fees, file fees, nothing like that. That's all your client's ever going to pay. You or your client's ever going to pay. And so now, let's walk through how we actually do the math. So I don't know if you remember that donut chart from earlier in the presentation, but we basically took our average percentage diverted visits of doctor office, urgent care, and ER visits, and then we used national averages for the average savings associated with an avoided doctor office, urgent care, or ER visit. Now, most people think these numbers are pretty fair-minded, and most of our clients are multi-state, so it's easier to do this, but we're happy to use the client's data. We're not trying to game the system at all. But in this example, you'll see we generated about $126,000 in hard dollar savings. They paid us a little bit over $53,000 for net savings of $72,626, or 136% return on investment. Now, real quickly, I just want to talk about how we actually measure that we've diverted a visit, because we do it in a much more fair-minded and transparent way than anyone else in the space. All telemedicine companies do the first part, which is they have the patient self-report if they didn't contact their telemedicine provider, what would they have done? I'd have gone to urgent care, the ER, I would have done nothing. But we're the only telemedicine company that does the second part. We ICD-10 code every single consultation and we match them up. So if someone self-reported they were going to go to urgent care and our doctor said, you know what, you need a strep test, go to urgent care, that would go into the no change in outcome column and there would be no savings associated with that consultation. So by doing it that way, it's about as close to a defensible saving number as you could than if you did year-over-year claims analysis. But I wanted to walk through a couple of scenarios just to make sure everyone's really clear about how our savings guarantee works. So let's say, I'll walk through three quick scenarios. So let's say we have an above average client, let's say a school district, and they have 80% utilization. They're going to have a net savings of $127,000 and a 238% return on investment. As you recall, our average results, 56% average utilization and 136% ROI. But let's say they're one of those, outlier clients. About 15% of our clients are going to be under that 25% utilization. So let's say we had someone at 24%. Well, they originally paid us $53,400. We're going to have to refund them a little bit over $10,000 to get them to that ROI. So 85% of our clients are going to have over 25% utilization and most likely be in the black, 25% or more. But if they happen to be one of those handful of clients, about 15% or so, where our savings guarantee is triggered, they're made whole plus 25%. Imagine a casino where for every dollar you bet on blackjack, you walked out with $1.25. There'll be a pretty big line out the door. So, you're probably familiar with, all of the other players in the space. They're going to cherry pick 3 or 4 clients and do some case studies. What we do instead, because our results are so good across the board, we actually do it at the industry level. So, and you'll see this variability. So government, has an 85% ROI, and healthcare has a 249% ROI. But there's no losers in the bunch. And like as an example, manufacturing, which is our single largest vertical and notoriously one of the most difficult to get utilization, we have 50% utilization, just a bit below our average, and an average ROI of 102%. So I want to talk a little bit about prescription discounts And I mostly want to talk about it not for the features so much, though I'm going to walk through that quickly, but just to talk about how we try to solve problems in general and try to be a little bit smarter and outside the box about how we come at it. So most folks are probably familiar with GoodRx and some other prescription discounting cards. And if you go online and read the reviews, about 50% of people are amazing, saved me a fortune, it was fantastic. The other 50%, well, I didn't know enough about my prescription, if it was extended release or how many milligrams, or they wanted me to change my pharmacy, or I forgot the coupon, or when I got to the pharmacy, they didn't honor the coupon and the price was different. It's just a mess. So what we did is we solved the problem in a completely different and fully integrated way where we, just like on the telemedicine side, we take all the friction out. So the use case is simple. Let's say you called First Stop Health, you weren't feeling well, you thought you had a sinus infection, our doctor agreed and was going to prescribe you amoxicillin. He's like, well, according to what we have for you on file, you want us to send it to the CVS on 125 Main Street. You're like, yes, that's where I want it sent. What's going to happen is, let's say your copay for that formulary for that amoxicillin would have been $15. 80% of the time, we're going to have that prescription at a lower cost, and we're going to send you a text message telling you so. So what we've done is in real time, we've identified whether or not you've met your deductible, whether or not you've met your out-of-pocket max, and what your copay would be for the formulary you just were prescribed by First Stop Health. In this example, we have for $8.22 instead of your $15 copay, but the beauty is all you have to do to redeem it is click on that link. It'll render a virtual RX card on your phone. You'll pay exactly $8.22 at the pharmacy you were going to go to anyway. You didn't have to know anything about your prescription. You didn't have to change your pharmacy. You didn't have to download or register or do any of that. We took all the friction out, and if you don't use it, you're no worse off. You pay your normal copay, but if you decide to click on that link, you're going to save yourself a few bucks. So now probably the most fun part of this presentation for me is to talk a little bit about what our clients are saying about us. And as I mentioned, we just recently completed our 2019 survey, so to share some of those results. So every year we ask the Net Promoter question, where you basically ask your clients, how likely would you be to recommend us to a friend or colleague? And they rate you 1 to 10. Anyone who's a 1 to a 6 is considered a detractor, 7 or 8 is neutral or passive, and a 9 or 10 is a promoter. So if every single one of your clients rated you a 1 to a 6, you'd have a negative 100 Net Promoter Score. If every client rated you a 9 or a 10, you'd be a plus 100 Net Promoter Score. Anything below 50 is considered poor. No shock where all the health insurance companies are, well below 50. And world-class, consumer brands are generally in that sort of 65 to 80 range. And here are some well-regarded brands. And here's First Stop Health. Plus 83 Net Promoter Score, the highest anywhere in healthcare. And the thing that was amazing about these results, 83% of our clients rated us a 9 or a 10, 17% rated us a 7 or an 8. We did not have a single detractor in our entire book of business. Think about how difficult that is to achieve. So as I mentioned, our plus 83 Net Promoter Score, we actually just found out this morning that we are number 375 on the Inc. 500 fastest growing private companies in the U.S. It's our second year being in the Inc. 500. Only 2.5% of Inc. 5,000 companies make the Inc. 500 2 years in a row. It's nearly impossible to do. 68% of our clients said employees specifically thanked the HR team for adding the First Stop Health telemedicine benefit. And this one really blew me away. We asked a Chinese menu. We gave our clients a Chinese menu of things that we could maybe improve on. 80% said nothing, that they were happy. Think about how hard it is when you give your clients an opportunity to complain that 80% don't take you up on it. 79% share the success of the First Stop Health program from a financial impact side with their CEO or CFO. And again, this one just blows me away. A little bit more than 2/3 thought more highly of their benefit consultant just because the benefit consultant introduced First Stop Health to the client. So I know we beat the superhero motif to death, so I'm almost done beating it to death, not quite. But so what's true about a superhero? Well, they all have a weakness. What's First Stop Health's kryptonite? So, again, most people are like, does seem like you have a better mousetrap, but we just got another 4% increase, another 6% increase, working on plan design, the cost shift to employees, stop loss coverage, whatever it might be. So another way to, so they're going to basically, there's something embedded through the carrier anyway, and so they're going to come talk to us next year. But another way to look at it is, if you look at our average client's results, net of our costs, we're generating a little bit over $6 in hard dollar savings on a per employee per month basis, net of our costs that could potentially help cover the cost of some other benefits. It's a really tight labor market, and HR teams are notoriously stretched thin. We're a way to potentially free up some budget dollars to help you have as competitive a benefits package as possible to help recruit and retain in a really tight labor market. What else is true about a superhero? Well, they're honest. Well, we try to be as transparent and fair-minded in our ROI calculations as we can possibly be. Happy to use the client's data, on savings per avoided visit. Not trying to game the numbers at all. They're respected. 66% of our clients think more highly of their benefit consultant because they introduced us. Saves people. Now, we may not save that many lives, but we certainly do save a ton of money. Average 136% return on investment. They protect you. Well, us too. We guarantee any self-funded client 125% savings guarantee, and we put 100% of our fees at risk to make sure that our client is completely financially protected. They get the job done. 56% average utilization, no cherry picking, and of course my favorite, our superpower, our plus 83 net promoter score, highest in healthcare, no detractors in our book of business. So as we're getting ready to wrap up here, and open it up and answer some questions for everyone, I do want to offer anyone that wants to free telemedicine for life. So anyone who's going to be out there and genuinely presenting us to their clients and prospects, we would love you to have firsthand experience with our telemedicine benefit. Obviously, we hope no one gets sick, but if you or someone in your family does, we'd love you to have an experience with the best in the industry, service, in our opinion. And you'll also get all of our communication materials, our welcome kit, our email campaigns, and what have you. So in a couple of slides, you'll see how to best contact us to set you up with a VIP account. So one of the last things before we open up for questions is, as I mentioned this morning, we just found out that we made the Inc. 500. And, just like you folks, 1/1 is insane for us. And so we always do a go early promotion at the end of every year to try to get some folks to come into, October, November, December and take some of the load off our client services team. And so what we're doing this year is to offer a free month to any new client who meets this criteria. Groups over 250 employees, has a 13-month or longer contract, and gives us all benefits eligible, not just benefits enrolled. Now, about 50% of our clients do that already, but anyway, just it's sort of a way to help, the way people think about it is, by getting a month free plus the 25% guarantee combined, that's about a 33%, 8% reduction because you're getting a month free, plus the 25%. Well, that extra 33% can almost certainly cover, the costs associated with covering all the folks that are not actually benefits eligible but not benefits enrolled. So by the end of today, every person who's attended the webinar should be getting an email directly from their sales director for their geography. And there'll be a couple of links at the bottom I'll just identify. So there's a request a proposal link that'll be at the bottom of their email signature. And all you'll have to do if you want a proposal for any upcoming renewal and strategy or prospecting meeting, you just answer 4 or 5 questions, very simple, name of the company, number of covered lives, self-funded, things like that. And if you do it in the morning, by the end of business, you should have the proposal. If you do it in the afternoon, you should get it next business day. Really quick turnaround. We want to be a resource for you folks. And if you have any questions, either about the proposal that we provided or just other questions, you can click on the schedule a call link and set up either a 15 or 30-minute conversation for, for you to talk to your direct sales director, for them to be able to help you in any way that you might like. And with that, I will open it up for questions. So, great. So, minimum group size. So that's going to go through the questions that people have asked. The minimum group size is we'll go down to 50. I would say our sweet spot is, again, self-funded, which is generally sort of that 250 to 10,000. But we'll go down to 50 as a as a courtesy to our benefit consultant partners. Next question. how do you address first dollar coverage on HSAs with high deductible health plans? Yeah, this is probably the most common question that we get. So basically, we believe we're an accepted benefit, and we have an opinion letter that positions that, and we're happy to send that to anyone who'd like. So when you get an email from your sales director, just ask them if you'd like that. But basically, there's 3 criteria to be an accepted benefit, like an EAP. You can't be coordinated with the health plan. We don't. You can't cost share. We don't. And it can't be significant medical care. We cover less things than an on-site clinic can do, and so most folks do not think we're first dollar coverage. With that said, we do have so we're happy to send you our opinion letter. I would say about 90% of our clients have qualified high deductible health plans. In fact, we have a 1,000-person ERISA law firm on the West Coast, and all they had us do was add language in the contract that said, because there's never been a black and white IRS ruling, that if there is one, they will immediately move folks to a consultation fee model. And again, we're happy to do that. And for those folks that are hyper-conservative, I'll just address that here. We will do a consultation fee, but a couple of things we do a little bit differently that we think really makes a huge difference. The 2 biggest complaints about telemedicine, the first one is no one uses it. We've already beat that one to death. But the second most common complaint is you harassed me to try this new telemedicine thing. I did. I paid my $40, and now they didn't give me a prescription. Now I got to pay another $40 to go to urgent care. They're really mad, and they'll tell everyone that'll listen they shouldn't try it either. So what we do for those handful of clients we have that sort of from a compliance standpoint being hyper conservative and want a consultation fee, what we'll do is we'll build it in, but we'll do it so that they're not asked to pay the consultation fee before the consult. They're asked to pay for after the consult, and only if they got a prescription. Because if you didn't get a prescription, you didn't really get treatment, you got advice, much like a nurse line, and no one thinks a nurse line is first dollar coverage. All right, next question. So would the discounted prescription cost still go towards the health plan's deductible and or out-of-pocket max? Yes. So we have the ability, we work through a clearinghouse company called Waystar. We're able to submit that information on a monthly or quarterly or annual basis, however you'd like to do it, so that the accumulation data is updated. Next question. Are the guarantees the same with fully insured clients? Okay, great question. So what we do for those folks that are fully insured is instead of having a savings guarantee, we really just convert it to a utilization guarantee, because obviously there isn't a real savings if they're fully insured, and you could even argue if they're level funded, it's not, it's harder to connect those dots. But so what we'll do is we'll have breakpoints at 15 and 25% utilization. So they could be paying as little as $1.75. Now again, we really don't have any clients under 15% utilization, but if for whatever reason your client was the outlier of outliers, and that way they feel like they're only paying for the value they get. I mean, probably a better way to say it is our pricing philosophy is pretty simple. We never want a client to pay more than the value we deliver, but our goal is 2x. Our goal is to deliver at least twice the value of our cost, which I think speaks to the fact that we have a plus 83 Net Promoter Score and no detractors in our book of business. Someone asked, what's our case resolution rate? I think what they mean by this is what's our referral rate. 92% of the calls that we take on average is going to divert a visit where they were going to go to urgent care, ER, or their primary care physician. Now, it really does differ by client, and that's one of the things that we do, none of the other providers do, is we actually track that individually by client. So we have some clients that might only have a 75, 78, 80% diverted visit rate, and some that are close to 98, 99%. So we'll use their actual experience. Okay, just a couple more questions here. How long does it take for us to be able to implement? So my client services team is thrilled when they have a month, but I would say a significant percentage of our clients are implemented in sort of a 2-week time frame. Really, the only critical path items are getting the contract signed so that we can get the data feed, and then getting the data feed. Generally, total amount of time spent by the benefit consultant and HR team is under 5 hours to do an implementation. We do a lot of off-cycle implementations for that reason, because it's a pretty light implementation. But yeah, so a month is more than enough time. A couple of weeks is plenty of time. Mentioned off cycle. Do we have an EAP or mental health benefit? So just starting this June, we started offering a fully integrated enhanced EAP benefit where we cross-pollinate. So when folks contact us on the telemedicine side, if they're inquiring about anxiety and depression, we can trigger messaging. So we have a fully integrated enhanced EAP offering. We really didn't have time to go into it on this call, so what I would suggest, if anyone's interested in that and you hear from your sales director, just set up a meeting with them and they can walk you through how that works. And I think that is the last of the questions. So I want to thank everyone for their time and attention. Really appreciate it. And really, please let us be a resource. Please take us up on our VIP account. We'd love you to have the experience firsthand, because we know once you do, you're going to become a partner of ours. Thanks, everyone, for your time and attention.